my goal for the next 4 years is actually to plant a seed for the long-awaited social change I just spoke about, and kind of enabling the process that will lead to a change for our community. And for this to happen, in my opinion, we need a 3-level strategy, and that's my plan. I mean, individual level, community level, and ultimately systemic level. I think at the individual and community level, the IBE can count on its membership and work with them to increase health literacy first, and engagement of people with epilepsy and their families, so that they become more and more able to cope with epilepsy, more effective in their interactions with the health system, and ultimately more fulfilled in their lives. So I think education and engagement are priorities in my plan. At the systemic level, you know, the IBE has always played a very crucial advocacy action together with the ILE, and I think global advocacy will be crucial during my term, with the, you know, the approval of this intersectoral global action plan on epilepsy and other neurological disorders. This will mark a major turning point after decades of relentless effort from the IBE and the ILE. I think we're now going to have to become even better advocates if we want to see this plan to turn into real change. For education, and when I speak about education and health literacy, the plan is to build a training program for people with epilepsy and their family first, that ultimately will increase their health literacy, of course, and their self-management capacity. You know, health literacy is an important determinant of health, and we believe we need to equip people with epilepsy with skills so that they can cope with epilepsy in their daily life and be more effective in looking after themselves, so that, you know, their quality of life would improve. And this program will be called the IBE Academy and will be a 2-level program. There will be, you know, training for people with epilepsy and families and caregivers on epilepsy and the management of epilepsy, but there will be also 2nd-level training for selected people and people committed to become epilepsy advocates. And the training will be different. We hope to train people who can stand up and speak for our community on behalf of you know, the 50 million people living with epilepsy worldwide, and interact with regulators, public health authorities, with the media, and with the civil society. So this is, you know, very briefly an overview, a rough overview of the IBE Academy.
The initiatives that Francesca started to discuss all link into a way of bringing people with epilepsy and their carers and the people who care for them into our global agenda, into our local agenda, of course, too, but also into our global agenda. The Academy is the sort of, if you like, the most ambitious part of this program. But we also have a research group that we're working on. We're looking at, let me just see what I've got down here. A youth action group, and we've got young people who are working with us and for us and with them and for them, other people, kids with epilepsy. And a group that we call professional achievements, so that we can help people to do something that with their lives that they want to do and that they've not thought they couldn't do before. So all of these sort of things link into the academy, and it sort of brings everything into the same goal, which is for people with epilepsy and people who care about them to actually run the epilepsy business rather than academics and clinicians, which is arguably the case. I've got nothing against doctors. I'm a doctor, but at the same time, doctors think differently from people who aren't medical. And although we're not saying we're never going to work with doctors, I think that the scenario that I see our organization going to is very different from the one that I'm coming from. And I would like to think that I was the guy who started it, who started the process, and Francesca's the guy who takes it forward, and then we'll see where it goes.